Scans, chemo, surgery, and treatment. That's all been part of my life this past year. My diagnosis came last November, 2 weeks after I turned 28 years old. But a month before, I sat down with Dr. Jill Westerkamp right here on Today in Iowa. You aren't yet 40. What do they do in the meantime?
So what we need to do is really be concerned about risk assessment and finding out what our risk is, because different women have different risks.
40 years old may be the recommendation for mammograms, but there is risk for cancer at any age. That's why Dr. Westerkamp joins us again this morning, 1 year later, to remind us of this life-saving information. Thank you for being here. It really is a full circle moment.
Yeah. For you it is, for sure. I'm really glad that you've gotten this far and you just had a great, moment last night. That was really nice of you to share.
Thank you so much. So as your role as a radiologist, it's really pivotal because you're often one of the first people that people meet on their cancer journey. Talk about that.
So my job is to find cancer at its earliest stage, right? So any imaging modality can detect cancer. You can see cancer in a lot of different ways, but mammograms are the ways that we find it at the earliest stages. And there's things that show on mammograms that we just don't see any other way. So I've really gotten into, my specialty is mammography, and I want to find the cancers. If they're going to be there, let's find them at the earliest stage so that we can affect the woman's life by curing it and saving her life.
Sure. You're often on the other end of the phone call when you tell people that devastating news, but you have the different perspective of, okay, we found it, so now we're going to fight it.
So it's going to be there whether women, look or not. And so in my view, when a woman walks through the door and we have the opportunity to find it, we have an opportunity to affect it. And so at any stage when a woman comes through the door, I want to find it as early as we can, of course. But even if she comes in later, I still think there's opportunity to affect her life because she has a gift, and we can affect that by helping her get through this.
Sure. There are so many different types of screenings. When is which one used?
So for an average woman, screening should begin at age 40 for everyone. Not every other year, not starting at 50. All of the studies have shown over 30 years to decrease mortality rates, which it's done for almost 40% for, to start at 40 every year. For women who are higher than normal risk, they should start earlier, and even at 25. So we should be talking about finding out what a woman's risk is so that we can start the screening protocol earlier if we need to.
Okay, how does one know their risk?
So there are risk assessment tools, and not all of them are equal. The John Stoddard uses the Tyrer-Cuzick because it's a very more accurate, takes into account a lot of different factors like age, weight, family history, breast tissue density. All of these things go into the risk factor. At Iowa Radiology, it's in our program, so we automatically calculate that, as does Lutheran, and that goes in the report, so women and doctors have those numbers. But if your number is greater than 20% for lifetime risk, you should begin MRI annually at age 25, and then at 30 we add in the mammograms, alternating those with the annual MRI.
Sure. That risk assessment tool, is that something people can find online?
Yes, I'm glad you asked because it is available. There's breast radiologists who have put together a tool that there's a website, and women can go in on their own and calculate their score, and it's not quite as accurate. I don't think it involves the breast tissue density, but it gets very close, and you can begin your conversation with your doctor about, should I be getting more higher level screening?
Okay, so a recap, what should everyone just keep in mind this October during Breast Cancer Awareness? What are some takeaways?
So women need to know that breast cancer affects 1 in 8 women, and if it's not in your family, 75% of the women we diagnose do not have it in their family. And so every woman at least at age 40 should be doing this. If they can get on and do a calculator, especially if you have a family history of ovarian or other types of cancers, get on there, or your aunts or your cousins have been diagnosed with breast cancer, please go calculate it so that if you are a higher than normal risk, we can start your screening earlier.
Okay, early detection truly does save
lives.
lives.
It does.
Dr. Westerkamp, thank you so much for joining us this morning.
You're so welcome.
We appreciate it. And we'll be sure to post the link to that risk assessment as well as the full interview on our website, WHO13.com, under the Surviving Breast Cancer tab. We'll be right back.